Hi, welcome to Newly Listed with the Canadian Securities Exchange. I'm your host, Barrington Miller, Director of Issuer Engagement, and today I'm here with Yaron Conforti, CEO, Director, and co-founder of Novamind Inc. Welcome to the show.
Hey, Barrington. Good to be here.
Tell us about what Novamind does.
Sure. Novamind is focused on psychedelic medicine. Specifically, we're building infrastructure for the psychedelic medicine sector. So we operate a network of mental health clinics. There's 4 of them in operation. And we also operate a CRO, which stands for Contract Research Organization. And that platform serves pharmaceutical clients, academic institutions, and other not-for-profits that are looking for drug development services.
As you know, this industry has sort of sort of taken off. And for Novamind, you have recently listed and gone public on the Canadian Securities Exchange. I know that you made a few key hires and you expanded your clinic capacity. That was in January. Tell us a little bit more about that.
In short, we partnered our way into this business. So you're absolutely right. There's a huge amount of interest, obviously, in capital flowing to the psychedelic medicine sector. When we started, the thesis was really, we incorporated the company about 2 years ago. So I'm a co-founder of this company, and I have 2 co-founders that are still on the board. 2 years ago, we incorporated the company and started making investments with the thesis that we were really seeking out the people that were treating people today. So where we ended up, cutting a long story short, is we in fact made some investments abroad in the Netherlands, where psilocybin is legal. But more importantly, we made 2 acquisitions in the United States, and those are our 2 core platforms. So the first is Cedar Psychiatry, and that's the 4 mental health clinics that I mentioned, and that's a network that's expanding very quickly. And the CRO I also described. So we acquired both of those entities, and they're now 100% owned by us. And really, the platform we're building is based on the pillars that existed in those businesses. So those businesses were founded by Dr. Reid Robison. He's now our Chief Medical Officer. Dr. Robison is also a coordinating investigator for the MAPS Phase 3 clinical trial using MDMA. He is both a clinician and a researcher. So essentially, we were able to partner with someone who was already very far along for many years now and well known in advancing psychedelic medicine, not only in terms of research to bring new drugs to market, but in terms of providing the legal options that are available today to his patients. So making those acquisitions really allowed us to leapfrog. Instead of waiting for the advent of psychedelic medicine, we're in the business of using the existing alternative health modalities, which I'll talk about. There are treatments that people can get now and legally and safely that are alternatives to the standard of care, most of which people are familiar with, involve some combination of SSRIs or antidepressants and some form of cognitive behavioral therapy, right? So these are the things, the modalities, if you will, or mental health approaches that we're familiar with. In many cases, they don't work. And our businesses are focusing on not only offering the existing modalities, but the alternative ones.
It's interesting that we're talking a lot more about mental health. For our audience and our listeners, if you are outside of Canada, we have something called Bell Let's Talk that discussed mental health and the beginning of the process that was last month. We've seen there's been a huge growth in this industry. I believe there's been a 100% growth in clinic visits between 2019 and 2020. How is Novamind meeting that demand?
By growing, in short. So again, yeah, you mentioned the 100% growth year over year. What we've done is we've published some news, and we've looked at the operating statistics from calendar 2020. So we looked at the segments that are growing. The amount of client visits we saw in 2019, the total was around 10,000, and the amount we saw in 2020 was over 20,000. So the demand certainly is there. It's exacerbated from our perspective in terms of, again, the incoming that we have. And we're not a heavily marketed business, I'll also add. So much of it is new patient and referral business, people seeking out those alternatives. So the answer to your question, Barrington, is to create access points. And that's really how I think of our alternative mental health clinics. And if the largest group of people, if you consider, are people that don't know about the alternative treatments. They don't have connections to people like me, or maybe psychiatrists, or people that can lead them down this path. So we want to make it effectively an on-ramp, if you will, for people that are looking for that alternative care and aren't well served by the standard of care, to provide, as I said, an access point where when they come into one of our clinics, just to give you a picture of what you'd see, it's that spectrum of services I described. So CBT, cognitive behavioral therapy, or a psychiatrist that can prescribe and do prescription management, maybe a nutritionist on staff approaching more holistic care. These are some of the more traditional or typical services. And when you add things like our specializations in ketamine-assisted psychotherapy, which people could access legally, ketamine being effectively the first legal psychedelic. We offer Spravato, which is the first prescription form of ketamine. We offer TMS, which is an acronym for transcranial magnetic stimulation. So these are regulated and approved mental health alternatives that are not widely available, where people would maybe have to go to a special place for specialized care. We want to create the opportunity where anybody can access that spectrum of alternative mental health modalities as easy as possible. So that's how we expand access and feed that demand that we're seeing.
We've run a few different I guess psilocybin psychedelic investing in psychedelic conferences, and one of the things, the renaissance of psychedelics, and that's one of the themes that came up a lot, was access and access to, and working alongside some organizations like MAPS. They're truly heavyweights. A lot of young companies that are in the space in psychedelics. How is Novamind positioned, at least strongly, when it comes to the science and mental health and evidence-based? Why is it so important for Novamind to be in that place?
I think it's ultra important, and I think it has to do with the particular part of the value chain that we're filling in psychedelics. So you've mentioned lots of companies, lots of entrepreneurs, lots of capital flow into the sector. You'll find the majority of that money and the majority of those business models are focused on drug development, also known as biotech investments. And it's a very well understood model, and it's a very lucrative model, and that is essentially you're spending hundreds of millions over a 10 plus year period towards drug approval so that you can get patent protection and sell those drugs. That is not our business model, and that is why it's important that we succeed, and I think we're very, very well positioned to succeed. Success for us means scaling our clinics and scaling our clinical research sites, and the two really go hand in hand, and there's a symbiotic relationship there. So when you ask, why is it important that Novamind holds this position, and you could argue it's important for many companies, but I'll focus in terms of advancing psychedelic medicine and bringing alternatives to people that need them. I think Novamind plays a unique role, and that is, first of all, we've described our mental health clinics, and it's essentially taking a sum of the parts sort of approach, that if you put all those alternative health modalities under one roof, and if you put the people who are experienced and practiced at training and helping people with them, then you're by definition you're aggregating some very, very specialized expertise and putting it all in one place for the people that need them. The goal there, to be really clear, is that not all modalities or therapies are for all people. So unless you have that spectrum and you take that personalized medicine approach and you try and match the treatment to the patient, you really can't fulfill that as a goal unless you have the breadth of services, and again, the training to offer those services, because these are not self-administered treatments. The second part of it is the clinical research part. So I mentioned our CMO, Dr. Robison, is one of the coordinating investors in the MAPS phase 3 trial. We're also involved in studies with the Ketamine Research Foundation around end-of-life distress. And there's some other studies, including Tourette's syndrome and borderline personality disorders, some involving some of the largest pharmaceutical companies in the world. So our offering, when people understand the role that we're playing in bringing the drugs to market, which again, I'll point out that most of these drugs are not self-administered in psychedelic medicine. It means you have to adhere to a therapeutic protocol to do this properly. You have to have trained therapists apply those protocols. So certainly our model and our expectation is, if we are trusted to bring these drugs to market through the clinical trial process, much like we're involved in the MDMA trials, then we expect to be trusted as a safe resource for people to access these experiences from themselves. And I don't know to date anybody that has quite our model, where again, we were both advancing psychedelic medicine in the clinic and providing it as clinicians to our clients. So that combination becomes really, really powerful.
You mentioned a couple points, your research arm and your clinic network. And I know you're running a lot of clinical trials on psychedelic medicine for major pharmaceutical companies, like you mentioned. I'm going to name drop like Johnson & Johnson, Janssen. It's the location of where you're doing it. And for our audience and listeners, it's in Utah. Why Utah?
That's a fair question, right? Of all the states, why that state? The short answer is Dr. Reed Robison. That's where Dr. Reed Robison is based. That's where he built the initial sites for our network of clinics. And that's where our dedicated research site is for Cedar Clinical Research. So, it was interesting when we made the acquisition, and pre-COVID, I was spending quite a bit of time going back and forth to Utah. What I realized pretty quickly that many people may not about Utah is that it's a pretty exciting story, insofar as that you have a very large, affluent and educated workforce. You have companies like Goldman Sachs, Google, Amazon, and other that have set up the major bases there. Like, I think Goldman, it's the largest outside of New York. And they're doing that because it's growing very, very quickly. It's been referred to as Silicon Slopes. If you look that up, you'll see a lot of media around that because of the tech companies being attracted there. So, yeah, we're in Utah for very particular reasons, and that's because our CMO's there, and because it's in fact a growth market where people have embraced our clinic model. It's where it's got its start. We owe it to them. So that's why we're there, but it's just the starting point. You'll see news from us growing out of that state. We'd like to be we're prioritizing other states in the United States, obviously, and as well, Canada has had a lot of policy moves that we're excited about, and providing access, for example, to end-of-life distress patients under a special exemption. That's, for us, symbolic, right? That the policy is starting to shift, and we want to be operating in places where the policy is going to shift, because those are the jurisdictions that are going to bring alternative therapies to market the quickest.
And this segues into my final question. When you talked about at least things coming out of Utah in the future of, what are the milestones that viewers, soon to be investors, would be investors, current investors, have to look forward to in the next coming months?
Broadly, growth are the milestones. Specifically, that comes in the form of, we're opening clinics. So organic and M&A, there's a pipeline for both for us to expand our clinics, and investors will be seeing that in the coming weeks and months. And again, the corollary to that is the clinical site expansion, excuse me. So the clinical site expansion allows us to offer those pharmaceutical companies and drug developers a more, let's say, comprehensive offering. You're in a much better position when you can offer multi-site than a single site. And so you can expect to see expansion of sites, expanding the sites, and then expanding the research trials that go with those sites. And on the clinic side, again, expanding into new jurisdictions and bringing that model to serve patients wherever we can.
Yaron, I want to thank you not only for your time, but also for your listing. I want to thank you and your team on behalf of the Canadian Securities Exchange for choosing to be here with us and for telling us about your company, Novamind, proudly trading on the Canadian Securities Exchange. I've been your host, Barrington Miller, here with Yaron Conforti, CEO, Director, and co-founder of Novamind. This has been a newly listed clip. Thank you.
Thank you.
Thank you for tuning in to another newly listed on the CSE. Please feel free to hit like and share this content and hit subscribe if you haven't already.